How does anesthesia work during TURBT bladder surgery? When it comes to transurethral resection of bladder tumor, or TURBT, anesthesia plays a crucial role in ensuring a smooth surgical experience. So, how does it work? During this procedure, anesthesia is used to keep the patient comfortable and still while the surgeon removes tumors from the bladder through the urethra. The choice of anesthesia depends on various factors, including the patient's health and specific surgical needs. There are two main types of anesthesia commonly used during TURBT: regional anesthesia and general anesthesia. Regional anesthesia, often referred to as spinal anesthesia, involves injecting anesthetic medication into the spinal fluid surrounding the lower spinal cord. This technique effectively blocks sensation and movement in the lower half of the body. It is often preferred because it provides excellent pain relief and muscle relaxation without some of the risks associated with general anesthesia, especially in older patients. However, one limitation of spinal anesthesia is that it does not block the obturator nerve reflex. This reflex can cause sudden contractions in the thigh muscles during bladder wall stimulation, which may increase the risk of bladder perforation during surgery. Spinal anesthesia is typically administered at specific lumbar levels using local anesthetics like bupivacaine. On the other hand, general anesthesia renders the patient completely unconscious and requires careful airway management, often using an endotracheal tube. This method allows for complete muscle relaxation through the use of neuromuscular blocking agents. By preventing the obturator nerve reflex, general anesthesia helps reduce the risk of bladder injury during tumor removal. It may be chosen when muscle control is critical or when there are factors that make spinal anesthesia less suitable. In some cases, an obturator nerve block can be performed alongside spinal anesthesia. This targeted nerve block specifically inhibits the obturator nerve, further reducing the risk of involuntary muscle contractions and bladder perforation. When it comes to the medications used, general anesthesia may start with agents like propofol for induction and muscle relaxants, such as rocuronium. Maintenance of anesthesia often involves inhaled anesthetics and opioids, while postoperative pain is managed with analgesics like acetaminophen. Interestingly, some studies suggest that spinal anesthesia might be linked to lower recurrence rates in non-muscle invasive bladder cancer compared to general anesthesia. However, this evidence is not definitive, and the choice of anesthesia should always prioritize patient safety and the specific needs of the surgery. In summary, anesthesia during TURBT works by either blocking nerve signals to the lower body with spinal anesthesia or inducing unconsciousness and muscle relaxation with general anesthesia. Each approach is tailored to minimize complications, ensure patient comfort, and create the best possible conditions for the surgical team to effectively treat bladder cancer. Always consult with healthcare professionals for personalized advice regarding anesthesia options for TURBT.